Hi there, I'm Dr. Leslie Masters. I want to talk to you more about metabolic medicine today. One thing I haven't covered before is, in a nutshell, what is metabolic medicine? If I decide I want to try metabolic medicine, what am I going to do? This is how the program goes. We give you a really detailed intake form. It's going to ask you questions that you feel like you're answering the same questions over and over again. How do you sleep? What do you eat? What do you do for stress? What do you do for that? Intake forms are, unlike your primary care doctor's office, aren't going to ask you what's wrong. We want to know what's right, what's changed, what's different, what you do for these things on your own and what you don't do. After we do a detailed intake form, and I've spent a good hour with you getting to know you better, what we'll likely do is do a biochemical evaluation of you. This can't be Dr. Oz type medicine where one size fits all. I can't tell you how many times I have patients come in and say, well, I'm taking this. I saw it on Dr. Oz. It's supposed to be good for you. Well, it's probably good for somebody. It may even be good for you, but we don't know that. When we do a biochemical evaluation, that's a fancy way of saying we're going to do some lab tests. We may test blood, we may test serum, we may test saliva, urine, stool. We will do some tests based on your intake form and look at you biochemically and decide what's working, what's not working, what do you have too much of, what do you have too little of, and may help you make some adjustments. When those labs come back, I'll sit down with you. We go over them one by one and decide what's best for you. This will undoubtedly, studies have shown it over and over again, involve some nutraceuticals, some supplements, whether they're vitamins, minerals, enzymes, cofactors, amino acids, fatty acids. It'll involve some supplementation. We just don't, even the best eaters, we just don't get what we need from our normal diet. Even when we go to Whole Foods for every meal and try to eat as healthy as we can, we're missing some things. So it will involve some nutraceuticals. Other things this involve have to do with, of course, nutrition, what you take in dietarily. We have a patient portal set up that took us 3 years to develop this portal. It has every lifestyle you can imagine on it. Whether you're a wine drinker and a Mediterranean lifestyle is going to work the best, or you've got a lot of food allergies and we should do an elimination lifestyle, elimination diet to determine what foods you're sensitive to. I've got one for pregnancy, vegetarians, even a caveman lifestyle. A lot of people have heard about the Paleolithic lifestyle or the caveman lifestyle. Eat like a caveman, meat, fish, fruit, vegetables, and nuts. It's a good starting point. It's a good jumping off point. What I like to stress to people is the nutritional information you'll get from this portal, which will come right to your handheld device, right to your phone every day. These are suggestions. These are ideas. This is not a diet. If diets worked, we'd all be skinny and we wouldn't be sitting here talking, right? Diets don't work. These are lifestyle changes. These are ideas for a lifestyle. If you tell me that you were following it, doing it just great, and then you had a bad day and so you started over, I'm not going to be happy. I'm going to feel like you're trying to follow this like a diet. What I want you to do is follow this like a lifestyle. It teaches us to make different decisions about what we eat and what we put in our bodies. When it's not about food and it's not about what we eat, it's going to be about activity. Whether you're a couch potato and I'm just encouraging you with your activity of the day is to get up and walk out to the mailbox to get the mail and walk back in, or you're a walker or a golfer or an athlete or a weightlifter, it'll have all sorts of activity programs to put on there. The other cool thing about the portal is we're going to address ways, what I group into a group called spirituality. How do you deal with the stresses of life? It doesn't matter how great you've got it, life's not easy. We know that the stresses of life will manifest themselves physically unless we handle them appropriately. Whether it's meditation or yoga or prayer or fellowship or church or taking a long walk by yourself or spending more time with friends, whatever you do to handle your problems begins to matter. On the portal, we have a lot of ideas and suggestions about how to handle that. So these are ways that you can use the portal information we're sending to you, but we ask you to send something back. We also get to graph on our patient portal how you're doing. I can follow your labs, I can follow your cholesterol level, I can follow what your blood pressure is doing, how much you weigh, your body fat index, or your percent body fat. I've got one gal that takes biotin and all of her B vitamins, and she's got it graphed how fast her hair grows each month. Anything we want to follow on you, but it lets us stay in touch with you and help you along this way. What I tell people over and over is this: change is hard. It's hard to change. Probably our biggest addiction is to our own patterns, our own ways of doing things. And it's hard to make a little change. Go home and change what side of the bed you sleep on at night. Things that we're just used to. They aren't necessarily healthy or unhealthy, but we're used to them. A lot of what metabolic medicine is making a little tiny pivot in the way we do things, the foods we choose, whether or not we get exercise, activity during the day, take the stairs, not the elevator type decision making can make us healthier. That's what metabolic medicine is all about. How do I make a change into a healthier me?